According to the U.S. Centers for Disease Control and Prevention, approximately 610,000 Americans die every year from heart disease. That means 1 out of every 4 American deaths is due to heart disease. A few minutes can be the difference between life and death for a patient suffering from a heart attack. Therefore, it's imperative that heart attacks are timely diagnosed and appropriately treated. Unfortunately, many people die every year because their medical providers fail to timely recognize and treat the signs and symptoms of an impending heart attack. Heart attacks happen when the blood flow to the heart is blocked. When that occurs, the heart muscle may become damaged or even die. Patients have the best chance for survival and a quicker recovery the sooner a heart attack is diagnosed and treated. Some of the most widely known and accepted signs and symptoms of an impending heart attack include vomiting or nausea, shortness of breath, dizziness, tingling, fullness, pain, or pressure in the chest area, often said to feel like an elephant sitting on your chest, sweating, pain in the upper body that extends to the jaw, shoulders, teeth, arms, back, or neck, indigestion, or prolonged heartburn. Some groups, women, the elderly, and the poor especially, are believed to have an increased risk for suffering heart attacks. In the U.S., more men die every year from heart attacks than do women. However, more American women suffer heart attacks than their male counterparts. Chest pain and tightness are the most common signs of an impending heart attack for women. Yet, approximately 40% of women suffering a heart attack don't have chest pain. Some other known signs and symptoms of heart attack in women include shortness of breath without chest discomfort or pain, back and jaw pain without chest discomfort, and anxiety and the feeling of a pounding heart. Sadly, too many physicians have been known to ignore these signs and symptoms or attribute them to less serious conditions than a heart attack, such as an anxiety attack or acid reflux. According to one study, women under the age of 55 have 7 times the risk for having their heart attacks go misdiagnosed as do their male counterparts. Again, these facts stress the importance of recognizing the constellation of signs and symptoms associated with impending heart attacks and responding accordingly. If a medical provider fails to diagnose and treat a patient suffering from a heart attack, the consequences can be devastating. Patients who aren't timely diagnosed are often discharged home, where they suffer a more serious, if not fatal, heart attack. Other patients' undiagnosed and untreated heart attacks can lead to their heart disease getting even worse. I'm Seth Gladstein, a trial lawyer located in Louisville, Kentucky. I focus my practice on medical malpractice, nursing home abuse, and other serious injury cases. If you or a loved one has been injured due to a medical provider's failure to timely diagnose and treat a heart attack, call us at Gladstein Law Firm at 502-855-4177 or 800-991-0474 to schedule your free no-cost consultation. You can always reach us online at www.gladsteinlawfirm.com. We can help explain the process for filing a Kentucky medical malpractice action, as well as the different types of damages a surviving spouse, a minor child, or an estate can possibly recover for a medical provider's negligent failure to diagnose a heart attack. Please don't wait to contact us. That's because your time to file a Kentucky medical malpractice action may be limited.